tube on. And again, 6.5, 6.0 is a good size to go with. And you just need to put it in far enough that the cuff goes through the hole. You don't need to go farther than that. It's a lot easier to write main stem, which is not the end of the world, right? You can always pull it back if that's the case, but it's going to be a lot shorter distance than it would be as if you came in from the mouth. So we'll go ahead and walk through the whole thing here with incisions and all. So I'm going to do the vertical and then the horizontal because I think that's the safest way to go. So I'm going to start up here. I'm going to cut above the thyroid cartilage. I'm staying in the midline. I'm going down, just about there, generous incision. You can see fat. And what I'm doing now is I'm going to repalpate. Got my thyroid cartilage again, cricoid down there. Cricothyroid membrane is essentially right down here below. And then I'm going to cut, and I can feel that I've cut into a space. I can put my finger in there, or I can put the bougie directly in there. Now I've got hang up right there. One thing you don't want to do is, a lot of people don't cut deep enough. They make a false passage in the skin, and then it stays in the skin. Because most people are afraid to cut, because the scalpel blade is not something you're using every day. So they're afraid to cut, so they make these little tiny incisions. They don't go deep enough. Most people aren't going that deep that they're going all the way into the esophagus. That's actually fairly rare. And then I want to follow this up with my ET tube. Sometimes you have to give it a little twist, just through, and then bougie comes out just like it normally would. I can throw my end-tidal CO2 on there. And then, of course, we're going to confirm like we normally do. Sometimes you get a little leak right there. Actually, even inflate the cuff too. Oops. But
Is this a sterile procedure?
At this point, no. I mean, once you're doing it for an emergency like this, you can splash some betadine on there, but it's not necessary. But we have end-tidal CO2. You get chest rise. Patient should be easy to bag, and that's what you were looking for. And actually, we are still getting a number, like I said before, which is kind of crazy. This is a cadaver, but we are getting an end-tidal CO2. We've confirmed now that we're in the airway with end-tidal CO2. Patient's easy to bag. Getting good equal bilateral chest rise, and essentially that's it. And of course, you want to secure it just like you want to secure any ET tube. You can actually cut the ET tube and make it shorter if you wanted to with your trauma shears, as long as you stay above the cuff. The problem with that a lot of times is you get to a hospital, then they think that it's deep, and then they pull it all the way out. Because they're like, oh, that tube's too deep. So I would leave it the way that it is, because that's what people are used to. But
secure it with a regular tube secure.
Yeah, or tape, something like that. But you can see, again, we're getting some end-tidal CO2 on a cadaver. And actually what I'll do now is I'll dissect down a little bit just so you can see some of this anatomy. You can see some muscle in there. That's normal. That's, if I go above here. See, there's the thyroid cartilage up there. See how hard it is. But you can see there's no, I'm staying in the midline. There's the big Adam's apple. I'm right below. You can see this was softer. This was easy for me to go through. So if I try to put my scalpel blade through this, look how hard all the time I have. I can't cut that. That's really, really tough. So if you're having a really hard time cutting, you're not in the right spot. Because, I mean, that's super tough. And it's, again, it's made to be tough because, again, it's protecting your vocal cords are right behind this. So that's why if you're cutting through something that's really hard and feels like bone, you're not in the right area. So that's why you want to reassess where you are. So it's very important that you find this. And you can see that's the prominence of the cartilage. Above, again, it's going to be soft up here because we're above the thyroid cartilage. This is where you don't want to make your cric. I went through the cricothyroid membrane here, and the cricoid cartilage is just below. Now, if I went a little lower into the trachea here, I have a trach. The patient's going to live. It's okay if you actually go a little lower than is necessary. But that's right through the cricothyroid membrane. And you'll be safe, again, if you stay in the midline, identify your anatomy. And I want you guys to come in here and really feel around. It's okay to cut through this muscle, but you don't see any big blood vessels in there, right? There's actually a little vein that's running right here. I stayed away from it. But if I'd cut it, it wouldn't have been the end of the world. It would have been okay if I'd cut it.